filming. You're good to go.
All right, so in an era where many people are interested in facelifts, deep plane facelifts, smash facelifts, which almost always involve a neck lift, in an era where neck lifts are very popular, in an era where platysmaplasty is a common part of facial rejuvenation, understanding the platysma is really important. And so I'm going to walk you through the platysma. I'm going to walk you through how platysma bands are formed, how they impact the anatomy of the neck, and how we treat them with a neck lift, with a platysmaplasty, and with a special type of platysmaplasty, which is really effective, very effective in minimizing the recurrence of platysmal bands. So let's start talking about the platysma. Well, what is the platysma? The platysma is a very thin muscle that lies beneath the skin. Interestingly enough, it starts on the face and it goes all the way down to the clavicles and even past them. It's just beneath the skin. There's a little bit of fat between the skin and the platysma. And underneath the platysma are the deep structures of the neck, some of which we address when we're dealing with a deep plane neck lift. Now, the platysma, again, is a muscle. And what we know about muscles is muscles basically only do one thing. They contract. So when the platysma contracts, it can create bands, especially on the edge of the muscle, the inner edge and the outer edge. As we get older, the platysma muscle tightens and those bands can become permanent. The bands are also exacerbated by loose skin that exists over the platysma. So herein lies the problem with facial aging, that we develop platysmal bands, which again, to some degree are a normal part of the anatomy, but we don't like the way that it looks. They get worse with age and they compound the problem of excess skin in the neck. So let's, for a moment, talk about why a facelift and a neck lift almost always goes together, although you can do an isolated neck lift in younger individuals that sometimes can be done through an incision that exists only beneath the chin and sometimes adding small incisions behind the ear. However, when someone's doing a facelift, we almost always do the neck lift because the smash tissue in the face, that's spelled SMAS, standing for subcutaneous musculoaponeurotic system, that smash tissue is contiguous. It runs right in to the platysma. So if we're going to make changes in the face, because of the anatomic link between the face and the neck through those tissues just beneath the skin, we really need to make adjustments to the neck as well. And that's good because that's what creates a comprehensive appearance for cervical facial rejuvenation or rejuvenation of the face and the neck or a facelift and a neck lift. Now, let's go on to talk a little bit about the excess that we sometimes see in the neck as it relates to skin so that we can also understand how we use the platysma to address that excess skin. So when a face ages, the skin slides down the face. We also get laxity, looseness of the skin in this direction as well. So we end up having excess of skin, loose skin in the neck that is both vertical and horizontal. The vertical excess is addressed with the facelift portion of the procedure. A neck lift, because that's a vertical vector, it's helping alleviate the excess skin in the neck. But remember, the aging, the excess skin is both up and down and back and forth. That back and forth, that horizontal excess, is addressed with the neck lift procedure. The neck lift procedure often involves, again, a small incision here to address the front of the platysma, and then incisions behind the ear and sometimes into the scalp that allow us to approach the platysma from the back. So we're addressing it from the front and from the back. Now, let's go on to talk about how we address it from the back, and then I'm going to advance to another slide where I'll show you how we address it from the front. Now, from the back, through these incisions, we dissect underneath the skin a little bit until we approach the lateral aspect of the platysma. And we elevate it, and we free it, and we bring that backwards in a direction that creates some tightness underneath the jaw, some tension. It's positive tension, it's positive tightness. It helps define the neck, and it helps define the jaw. Nobody wants to hear the word tight, but you can't escape the fact that that's part of what we're doing in a face and a neck lift. And it's something that patients ultimately get used to when things do loosen in a very favorable and comfortable way in time without losing the results. So that's how we approach the platysma from the back. Sometimes we'll elevate the skin off of the platysma so that we can redrape the skin even more, but sometimes we leave it attached and we use the platysma to relocate the skin, reposition the skin, redrape the skin as a composite of that platysma muscle. Now, this is where I wanted to get to, talking about the anterior platysma and how we address that as the front part of a neck lift, that anterior portion, because that's really where the platysmal bands are most evident. All right, so again, the platysmal bands are formed by having a tightness and a separation of those muscles, and that tightness and that separation actually creates a bowstring effect from where they attach on the jaw to where they attach lower on the clavicle. And when they tighten, they pull the skin away and they pull the muscle away from the deeper tissues causing platysmal bands. Let me show you. We see some on the outside, but we also see some on the inside. That's where the platysma naturally is separated. And again, when it tightens, it creates a bowstring effect from the jaw down to the clavicle. How do we address that? Well, with a platysmaplasty, what we do is we bring those muscles together. Automatically, if we bring those muscles together, it creates a degree of tightness and repositioning, bringing those muscles backwards towards the deeper structures. And because they're anchored together, they have a much more difficult time separating or spreading away from the underlying deep tissues when you animate, when you make motions in your face. That in and of itself can help with the platysmal bands, and it can help define a very nice cervical mental angle. But it's not always the best way to go about it. And the reason for that is that some of that tension is still there, and you can even get some separation of the platysmal muscles because they are thin muscles, and those sutures can pull away from one another. And that's where, in my opinion, the most effective approach in dealing with platysmal bands and with dealing with neck contouring when we're doing a neck lift, whether it be with a deep plane facelift or a smash lift, or without as an isolated procedure, again, usually in young individuals. So let me show you this next slide. And what this next slide is going to demonstrate is that how with a small modification of the platysmal muscle in the front, we can significantly reduce the platysmal bands, and we can further enhance the contour of the neck. Because remember, from the posterior, the side approach, we're creating redraping of the skin and the muscle, shaping the jaw posteriorly, but we do need to address it from the front in most patients because of that platysmal separation in most patients. Not all patients have that platysmal separation, and not all patients have platysmal bands. And in those patients, sometimes strategically, we don't actually address the muscle and the skin from the front because we can address it from posteriorly. But again, in most patients, they do have platysmal bands, or they have other reasons to make the incision here. That's called a submental incision. So let's go on to my favorite approach, the approach that I rely on the most to address platysmal bands and resculpting the neck as part of a deep plane facelift and a deep plane neck lift. So that's a platysmaplasty. Again, a platysmaplasty is a plastical surgical procedure designed to improve the contours of the neck by bringing the platysma muscle together, creating a support like trampoline and structure, and also by bringing them together, decreasing their tendency for pulling away from the neck. Sometimes that's called a platysmal corset, most often called a platysmaplasty. Now, you see that second word, myotomy. So what does myotomy mean? So myotomy means making an incision in the platysmal muscle. Now, generally, we aim not to cut muscles when we're doing surgery. However, sometimes it's important to do it very strategically. And a myotomy in the platysma can be performed in a way that doesn't alter the important functions of the platysma, but can significantly reduce the potential for having recurrent platysmal bands and also further helping contour the neck. And the way we do that is by making a very small incision in the platysma right about here, often less than an inch, a very small amount. And what that does is it reduces the tension from the chin down to the clavicle, so that when the platysma muscle tries to activate with animation and motion, it still animates, it still activates, it still moves in its natural way. But what happens is that tension is diverted towards the center part of the muscle because it can't really be transmitted through that very small myotomy. And therefore, we don't get the muscle pulling away from the neck, pulling away from the deeper structures. Furthermore, by making that little notch there on both sides, it allows that muscle sling to slide a little bit further back and up, further defining the anterior or the front part of the neck as part of a deep plane neck lift, deep plane facelift. So, platysma myotomy is an important add-on to a platysmaplasty that sometimes is missed, but it's one of my favored approaches to addressing the platysmal anatomy and how it brings out a really attractive neck when we're doing a neck lift. Now, I've mentioned deep plane neck lift a couple of times, and I want to speak to that just a little bit more. So, addressing the platysma itself does not inherently make a neck lift a deep plane neck lift. What does is addressing some of the structures beneath the platysma, which is often a part of how I approach a deep plane neck lift. There are 3 structures that are addressed, and in a future video, I'm going to go over those in more detail. But let me introduce those ideas, those concepts of the deep plane neck lift that's done with a platysmaplasty as part of a deep plane facelift or even a high smash facelift, depending on what's indicated for the procedure for the patient. Now, those 3 structures, or the 3 bits of anatomy that we address, are the subplatysmal fat, sub meaning below the platysma. That's located in the center part of the triangle that exists beneath our jaw. Then the other structure that is addressed is the anterior belly of the digastric muscle. The digastric muscle is a muscle. It's called digastric because it has 2 bellies. We refer to muscle bellies when we talk about anatomy. So the digastric muscle is a muscle that has 2 bellies. One belly or segment goes from here to here, and the other segment goes further back on the neck. That front segment with overuse and with age can become large. That's called hypertrophied. And we carefully remove just a little bit of that muscle tangential to the long axis of the muscle. So it doesn't reduce the important function of that muscle, but what it does is it reduces that excess bulk that have formed over time. And then the final thing that is addressed in a deep plane neck lift is the submandibular gland. We have 4 spit glands, if you will, or saliva glands, parotid, submandibular, submandibular. There are smaller ones, but 4 major ones. And what we do is we shave a very small portion off of the excess of submandibular gland that can develop with age. Now, you guys may be wondering, does this decrease the potential for creating spit and having a dry mouth? That is a theoretical concern, which I've not actually seen in any of my patients. The important magic of a deep plane neck lift, though, is to address these structures in a cautious and artistic way. You don't want to remove all of the subplatysmal fat. you clearly don't want to remove all of the submandibular gland or the anterior belly of the digastrics. But by being very deliberate and very careful, you can really help add additional sculpting power to a neck lift by addressing these structures. It's an advanced procedure that it's often best to have someone with additional training, such as myself, a facial aesthetic plastic surgeon who's done 2 fellowships focused on this. This is a really important adjuvant. Neck lifts are a really important part of facelifts, and we know nowadays facelifts are very hot. People are really interested in them. The social stigma has diminished, and people really are embracing this as a way to recapture the youthful and vibrant appearance of their face. So if you're interested in a consultation, it's Adam Weinfeld, located in Austin, Texas. You can find me at drweinfeld.com, spelled drweinfeld.com, or at austinplasticsurgeon.com, which is my home for all of my aesthetic surgery. Look forward to seeing you. Bye.